So, good day. I will introduce myself first. My name is Nadien Espina, and I will be nurse here for today. And now I will interview the health purpose. So, may I know what is your name?
Stephanie Shin,
Age?
19,
Civil status?
single,
Place of residence?
Lapu-Lapu City,
Admitting complaints?
chest complaint,
Number of admission prior?
1,
Religion?
Catholic,
Admission date?
April 27,
How was you admitted? History of present illness? So, can you narrate exactly what happened prior to your admission?
having a chest pain and back pain,
When did it start? What symptom did you observe? For how long?
it was 3 to 4 weeks last, and I'm having a sharp pain in the chest and back.
Precipitation factors, what did you do or were you doing when it happened?
It was suddenly, I feel sudden pain in my
Relieving factors, what activity relieves the problem?
when I'm taking a rest.
Did you self-medicate? What were the drugs and any relief?
None of
Did you practice herbal medication like full medicine? And if yes, what were these in compliance relief noted?
only ascorbic acid and iron supplements.
Okay. Any consultation done? Who was the doctor?
I can't remember the person.
The doctor prescribed any medication? What were those in compliance relief noted?
It's a pain reliever.
Diagnosis made by the doctor.
Wala.
Any laboratory exam done before admission or result? Who recommended hospitalization? What prompted you to seek medical attention?
Myself.
Okay. So, past health history. Hypertensive. If normal average in blood pressure.
150 over 79.
Di ba tama? So, what were these? When diagnosed, highest blood pressure, relief noted, any maintenance needs, diabetic, smoker, alcoholic,
Only during celebration.
smoker, alcoholic.
Eh,
If yes, how long have you been drinking?
can't remember.
When do you usually drink?
During celebrations.
Previous hospitalization. How many times have you been hospitalized?
First time.
Previous hospitalization. How many times have you been hospitalized? Environmental history. Where do you live?
Pusok, Lapu-Lapu City.
How long have you lived there?
19 years.
How far from the nearest health center?
Very near.
Okay. Urban, suburban, or rural?
Urban.
Is the house and lot owned?
Yes.
How many people sleep in each room?
1 or 3.
Pete, how many if you have Pete, How many? How many bedrooms?
5.
Okay. How far it is from the church?
Very near.
How far from the barangay hall?
Like 1 kilometer.
Water source supplied by.
CWD.
How many people live in household?
7, 6, 8.
How many windows?
8.
Home accessible to market?
Yes.
Peace and order situation in area?
There's a peace in order in the area.
How many stories?
Many.
How far it is from the main road?
Not far.
Describe neighborhood congested?
Congested.
Electricity or supply by
Micro.
adequate sleeping quarters?
Yes.
Space around house or fire hole?
No.
Home accessible to transportation?
Yes.
Health position, health management. How do you look at life and our health, good or bad?
Good.
How would you rate your health and why?
7/10.
Why?
Because I don't eat very well.
Okay. Do you usually go for primary health care?
No.
How often or when do you see the doctor?
Sometimes.
Do you see doctor or practice cold medicine? Do you practice self medication? Why or why not?
Sometimes. I do exercises sometimes.
Nutritional metabolic patterns. Height,
157 centimeters.
weight,
40 kilograms.
with whom do you usually eat and where?
Usually only with myself.
Any favorite foods? It's what are these?
Chicken breast, meat, other vegetables.
Okay. And do you have any problems in eating?
Yes.
Do you have regular dental examination?
No.
How often or when do you see a dentist? Have you consulted one? Do you have dessert? How about fillings and any missing teeth?
No.
Do you take supplements and what are these if any?
Food supplements.
Do you take fruits daily and what are these?
No.
Has your diet changed with your illness and hospitalization?
No.
How many liquids do you usually take in per day? How many liquid do you usually take in day?
Like 1 liter per day.
Any weight loss noted?
Yes.
Elimination pattern. How often do you eliminate your bowel?
Twice a week or thrice a week.
What are your bowel habit? When do you usually move your bowel?
Sa pagtulog ko.
Describe your toes color and form.
Brown.
Do you use laxative and any difficult eliminating bowel? Do you experience constipation? If so, what do you to receive it?
Yes.
Describe your urine color and clear.
Like yellowish.
Okay. How strong is your urine flow?
Not so strong.
How much do you usually void per sitting or per day?
Sometimes,
Any problem with voiding, like pain, blood?
yes.
Has your sickness or hospitalization changed your elimination? And activity exercise pattern. What is your occupation in life?
No, I'm still a student.
Describe your job, like stressful, physical, and what do you do?
Stressful.
And what do you do?
Take a rest.
What do you do after waking?
Take my cell phone.
Okay. What do you usually do after breakfast, lunch, and dinner?
Playing in bed.
What do you usually do in the morning, afternoon, and evening?
Lying in bed always.
Okay. What do you usually do before going to bed?
Brushing my teeth and wash my face.
So, do you practice regular exercise?
So, sometimes only.
What do you do for reactions?
Reactions.
What do you do for reactions? What do you usually spend reactional time with?
Only myself.
Has your sickness changed your activity pattern and what way?
Not really.
Okay. Sleep and rest pattern. How often do you usually do act? Has your illness affected your sexual activities and what way? Compensate and stress tolerate patterns. How would you view or define stress in your own?
Being pressured.
Do you believe you are stressed right now and why or why not?
Yes.
Why?
Every time I do school works, I'm always tired.
Okay.
Lot of things in mind.
So who makes most of the major decision in your family?
My father.
Do you consult with other members before making such decision?
No.
Who runs the everyday activities of the house?
My father.
What can you say about your current illness?
Nothing.
What is your outlook in life, good or bad?
Good and bad.
Okay. Do you currently have any major family problems and what are these?
Financial problem.
Been honestly getting enough rest lately?
No.
Do you have siesta time after meal and do you take naps?
I don't have time for meals. I always take nap.
Cognitive perceptual pattern is patient-oriented in time, place, and people.
Pardon?
Is patient-oriented in time, place, and people. Patient sensory status. Is patient able to recall past event? Does patient know his name and how old he is?
Yes.
Is patient able to recall the event happened yesterday? Has patient condition markedly affected his cognition and perception?
Yes.
In what way?
Unable to focus.
Self-perception and self-concept pattern. How do you see yourself? And it is positive or negative way?
Positive and negative way.
Both. What can you say about yourself?
a lazy person but have goals.
How about accomplishment in life? What can you say about your life? How have you lived it?
Good.
Are you satisfied with how things have gone for you?
No.
Are you happy with yourself and what you've done in your life? Yeah. Are you happy with yourself and what you have done in your life?
No.
Any problems, worries, or concern as of now?
Yes.
First, about your illness. First, about your illness, yung kaglukan.
I might die at a young age.
Do you believe that you will be cured?
Yes.
Has your current condition affected your perception?
Yes.
Role relation is pattern. What do you occupy in your family? Are you the oldest or youngest?
Second to the oldest.
How many siblings do you have? How good is your relation with them?
4. 5. Good.
How many children do you have?
None.
What is your role in your current family? Are you are you happy with it?
No.
Why? Do you have a lot of friends, acquaintances, and relatives?
Only few.
How is your relation with these people?
Good.
Has your current condition affected your relation or the way you interact with other people? In what way?
Yes. Don't socialize now.
Sexual reproductive pattern. With you, puberty start? Did you notice?
When I'm 14 years old,
What did you notice?
abdominal pain.
So that's all. Thank you for your cooperation about my interview and about the health purpose.